In a nutshell, what is your vision for the future of trans healthcare in the UK and further afield?
So, in a nutshell, very easy. Just the same as all other healthcare. So if you have an issue with your elbow, if you have a need for contraception, if you are pregnant and you didn't mean to be and it's not sitting well with you, if you've got a cataract in your eye, the first thing you do is go to your GP, and your GP will do all the basic healthcare that they can possibly do. If your GP can't do the cataract, if your GP can't do the hip operation, if your GP can't manage help with your abortion, then you refer them on to a more specialist place, which is usually your local hospital. So the majority of transgender patients of all ages will be treated by their GP. If it's a little bit more tricky, then they will go to their local hospital and have care there. If it's super tricky, like liver transplants or like heart transplants, for example, those things are treated in tertiary centres, which are super specialists, just like one in London, one in Birmingham, one in Scotland. And those are left for the really tricky stuff that your local GP and your local hospital can't sort out.
So where does GenderGP fit within that model?
GenderGP is creating that model. It is creating the model that you don't need to go through long lengthy assessment periods to have your gender validated. It's normalising hormone therapy for trans people and recognising that if you start hormone therapy and it doesn't turn out to be right for you, that is absolutely okay. And giving access to the super specialist counsellors and support team that we have. Not every case is simple, not every case is easy. Some need some real digging and work to really work out what that gender means to you, whether it's a binary gender or a non-binary gender, how it fits in with your sexuality, your family, your home, and all of your world. So GenderGP is creating the model of care for the future.